Video is stuck. Okay. Okay, the video is stuck. Video is stuck. Okay. Okay, the video is stuck. Video is stuck. Okay. Now clear? Chalo. Now since it is clear, let us quickly get going. ठीक है. So the first question for the day is, what is the most sensitive method for screening of cancer cervix? So what is the most sensitive method for screening of cancer cervix? Anyone? Tell me quickly, what is the most sensitive method for screening of cancer cervix? So most sensitive method is HPV DNA testing. Right? The first question related to screening is, what is the most sensitive method? And that is HPV DNA testing. What is the most specific method? Most specific is pap smear. Clear to all of you? Yes. Now, WHO recommends two approaches. One is screen and treat approach. Screen and treat approach का मतलब क्या है? WHO कहता है कि स्क्रीनिंग करो एंड स्क्रीनिंग के बेसिस रिजल्ट के बेसिस पे गो फॉर ट्रीटमेंट. Now for screen and treat approach, WHO says the best test to do is HPV DNA. And अगर HPV DNA available नहीं है किसी एरिया में, then you have to go for visual inspection with acetic acid. Please remember, WHO के recommendations are for resource limited country. It is for resource limited countries like India, right? So WHO कहता है कि इंडिया जैसी कंट्री में we have to go for screen and treat approach. So screen and treat approach के लिए best is HPV DNA testing. If that is not available, go for VIA. Now I need to tell you a few important things related to both these investigations. Please remember, HPV DNA testing. Now the time to start HPV DNA testing, कभी भी females who are less than 30 years में we don't prefer. HPV DNA testing should be done in age group. HPV DNA testing should be done in age group more than 30 years. Earliest it can be done in females more than 25 years, right? Now, whenever you are doing HPV DNA testing, suppose you are doing HPV DNA plus pap smear together. This is what is called as co-test, right? And if HPV DNA is done, if HPV DNA testing is done, these are general points on HPV DNA. I am not telling कि WHO क्या कह रहा है. I am just now telling you general points on HPV DNA testing. So if HPV DNA testing is done after an abnormal pap smear report, right, then it is called as reflex testing. Then it is called as reflex testing, right? Now HPV DNA टेस्टिंग की टेक्निक कौन सी यूज करते हैं? वी यूज हाइब्रिड कैप्चर टेक्निक. Hybrid capture technique. That is the technique used for HPV DNA testing. Very, very important. Now, HPV DNA testing doesn't tell you the exact subtype of HPV. It will not tell you the exact subtype of HPV which is present in the female. It is only going to tell you, it only tells that high risk HPV is present in the female's body. High risk HPV is present. That is all what HPV DNA testing tells you, right? Now, this is what you need to know on HPV DNA testing. Right now, what you need to know on VIA. VIA. What is VIA? VIA is visual inspection with acetic acid. Visual inspection with acetic acid. Kitna acetic acid? 3 to 5% acetic acid, right? So visual inspection with acetic acid में क्या करते हैं? Whenever a female is coming to us, we are applying acetic acid on the female's cervix and then we are looking at the cervix. Now after applying acetic acid, if the cervix is pink, राइट नॉर्मली भी पिंक कलर की होती है, सर्विक्स अगर पिंक दिख रही है दैट मीन्स एवरीथिंग इज नॉर्मल, देयर इज नो प्रॉब्लम. बट इफ सर्विक्स अपीयर्स white in color, right, that means this is abnormal and that means कि yes dysplasia present है. Dysplasia is present. Please remember, dysplasia is a pre-malignant condition. And that is what WHO says कि आपका स्क्रीनिंग मेथड ऐसा मेथड होना चाहिए कि जब आपके पास पेशेंट आए आपने स्क्रीनिंग किया एंड साथ के साथ ट्रीटमेंट कर दिया. That is why WHO is not recommending pap smear. Pap smear में क्या होता है? If you get an abnormal report of pap smear, always you have to follow it up with biopsy. That is colposcopy and biopsy. तो imagine इंडिया में एक तो वैसे ही cancer cervix is the most common female genital tract cancer. And generally it is seen in low socioeconomic status. Generally it is seen in females who have multiple sex partners. तो ऐसे में यू टेल देम कि पहले हमारे पास आओ, आई विल डू योर पैप स्मेयर. फिर वो फीमेल आए आपके पास रिपोर्ट पूछने पैप स्मेयर की रिपोर्ट अब नॉर्मल है तो अब उसको कहो कि अब हम तुम्हारी कॉल्पोस्कोपी करेंगे, राइट? फिर कॉल्पोस्कोपी की रिपोर्ट आएगी एंड देन बेस्ड ऑन द रिपोर्ट हम ट्रीटमेंट करेंगे. पेशेंट कभी भी आएगी नहीं आपके पास दोबारा से जब उसको पता लगेगा कि ओ इतनी बार आना है, राइट? So that is why WHO says कि wherever you have a resource limited country, don't go for pap smear. Go for a method जैसे अब suppose it is VIA. हमने कैंप लगाया, we have called females, right? हमने उनकी cervix को acetic acid से पेंट किया and अगर white दिख रही है तो साथ के साथ मैनेज कर दिया. So patient needs to come to you only once. Clear to all of you? Yes. Now a very important question which they ask you is that stained areas in VIA, stained areas in VIA, what do they indicate? They indicate abnormality, right? White color का अगर stain मिल रहा है तो stained अगर आ रहा है that means abnormal. Unstained है अगर it remains pink, that means it is normal. Have you understood? Clear to all of you? So WHO is saying that you should be adopting a screen and treat approach. According to screen and treat approach, according to WHO, the best test to do is HPV DNA testing. अगर वो positive आ गया तो treat कर दो, या VIA करो, VIA का result positive आया. So अगर result positive आता है, if any of them come out to be positive, then immediately I am going to do the treatment. Now, the second approach by WHO is screen, triage and treat approach. Now, what is this screen, triage and treat approach? Screen, triage and treat approach में WHO कहता है कि पहले आप HPV DNA testing करो, right? HPV DNA testing अगर positive आती है तो go to the next step, that is VIA. And VIA भी अगर positive आता है then you go for treatment. So it says कि you have to do two screening tests. One is HPV DNA testing and the other one is VIA. So that is screen, triage and treat approach, which WHO is recommending for countries like India. Right? So this is very, very important what you have to remember. Then next very important thing which you have to remember is best क्या है? Best according to WHO, best according to WHO is screen, triage and treat approach. तो कभी भी कोई पूछे कि according to WHO what is the best screening test, your answer has to be HPV DNA testing plus VIA. अगर ऑप्शंस में ये दोनों नहीं दिए हैं टुगेदर, यू नो, इफ दे हैवंट गिवन यू दिस टुगेदर, दैट HPV DNA testing and VIA, then the second best answer is HPV DNA testing and the third best answer is VIA, right? According to WHO, I am telling you only WHO recommendations. According to WHO, the age to start screening is 31 years. Right? So screening has to be done and it has to be stopped at 50 years. So you have to start screening at 31 years and you have to stop the screening at 50 years. Right? Now, HPV DNA testing का interval कितना होना चाहिए? According to WHO, HPV testing should be done in general population after every 5 to 10 years. And in HIV positive females after every 3 to 5 years. Right? Next very important question. Next important question is, if your patient is HPV positive and VIA negative, यानी कि आपने screen, triage and treat approach किया, स्क्रीन, ट्रायज एंड ट्रीट अप्रोच में HPV पॉजिटिव आया, लेकिन जब आपने VIA किया, VIA comes out to be negative, right? VIA has come out to be negative. Now what are you going to do? Now are you going to do HPV DNA testing after 5 to 10 years? No, beta. Now in this case, you have to do HPV DNA testing in 2 years in general population and after 1 year in HIV positive females. Normally WHO कहता है कि अगर HPV testing negative आता है तो in general population you have to repeat it after every 5 to 10 years and in HIV positive after 3 to 5 years. लेकिन HPV positive आया and VIA negative आया, then इतना लंबा टाइम नहीं लगाना है हमें HPV testing के लिए. Then in that case HPV testing again has to be done after 2 years in general population and after 1 year in HIV positive females. Right? Now, after how long should VIA be repeated? VIA should be repeated after every 3 years. VIA should be repeated. अगर normal आ रहा है तो it should be repeated after every 3 years. Very important कि VIA को every 3 years WHO कहता है and HPV DNA testing general population में 5 to 10 years and HIV positive में 3 to 5 years. अब WHO तो कहता है कि देखो और ट्रीट कर दो, राइट? सो देखो और ट्रीट कर दो में क्या ट्रीटमेंट करो? द ट्रीटमेंट विच WHO recommends is LLETZ. LLETZ. LLETZ का क्या मतलब है? लार्ज लूप एक्सिशन ऑफ ट्रांसफॉर्मेशन zone. Large loop excision of transformation zone. This is not required by you. So WHO कहता है कि स्क्रीन करो एंड स्क्रीनिंग पॉजिटिव आई तो ट्रीटमेंट करो. क्या ट्रीटमेंट करना है? LLETZ, राइट? स्क्रीन करो, फिर ट्रायज करो तो HPV करो एंड HPV पॉजिटिव आया तो VIA करो, VIA भी पॉजिटिव आया तो ट्रीट करो. ट्रीट कैसे करना है? LLETZ से करना है. Right? So if your tests are coming positive, you have to give treatment. And what is the treatment? LLETZ, large loop excision of transformation zone, which is an OPD procedure which requires no anesthesia. Right? So simply WHO कहता है एक OPD procedure है. Call your patients. राइट, एसिटिक एसिड लगाओ. अगर दिख रहा है कि अब नॉर्मल एरिया प्रेजेंट है तो इमीडिएटली साइमल्टेनियसली ट्रीटमेंट कर दो एंड टेल द पेशेंट दैट नाउ यू आर ओके. क्लियर टू ऑल ऑफ यू? यस. सो दिस इज व्हाट WHO recommends. Now what ACOG recommends, international guidelines क्या हैं? International guidelines वो guidelines हैं which you have been studying till now, and that is what I always tell you. You have to know international guidelines, but more important than that are national guidelines. Wherever our national guidelines are available, हमें वो नेशनल गाइडलाइंस जरूर पता होनी चाहिए. एंड यहाँ पे बिकॉज हमारे पास नेशनल गाइडलाइंस नहीं है कैंसर सर्विक्स स्क्रीनिंग की, सो आई हैव टू नो गाइडलाइंस ऑफ ACOG एंड आई हैव टू नो गाइडलाइंस ऑफ WHO as well, right? Okay. Now, what happened, Abhinandan? Any query? Any one of you have any doubts in your mind just now? Any doubts? Let me know. No doubt? चलो. So ACOG क्या recommend करता है? ACOG कहता है that screening has to be done from 21 to 65 years. Screening start करोगे 21 years पे and जो method use करोगे that is pap smear. Right? Pap smear has to be repeated after every 3 years. Right? Till the age of 30 years. From the age of 30 to 65 years, the moment patient becomes 30 years old, then you have to do pap smear plus HPV DNA testing, which is called as a co-test, and it should be repeated after every 5 years till 65 years of age. Till 65 years of age. So 21 years से start करना है, 65 तक जाना है according to ACOG. According to WHO 30 से 50 वाली range होती है. Right? Clear? Okay. WHO pap smear नहीं recommend करता है. ACOG is recommending pap smear. So pap smear otherwise is very, very important for you. For pap smear, what are the instruments which you use? So in pap smear, the instruments which you use are A, and so this over here is A. What is this A? This A is Ayer's spatula. Ayer's spatula. Right? And you use an instrument which is a brush type of an instrument. This is endocervical brush. Endocervical brush. So you are using Ayer's spatula and endocervical brush. ये जो Ayer's spatula होता है ये plastic भी हो सकता है and it can be wooden. Right? It has this bifid end. तो जो Ayer's spatula का bifid end होता है, from there you are going to take sample from transformation zone. So जो Ayer's spatula का ये bifid वाला end होता है, no beta, if hysterectomy has been done, you have to stop the screening, right? So if hysterectomy is done for benign reasons, then you should stop the screening. Clear? Okay. So with the help of Ayer's spatula, so Ayer's spatula का एक ये देखो, this is the bifid end of Ayer's spatula. So from this bifid end of Ayer's spatula, you are going to take sample from transformation zone. What is TZ? It is transformation zone, right? Then अगर transformation zone options में नहीं दिया है, then squamocolumnar junction, SC junction. Then with the help of endocervical brush, you will take sample from endocervix. So दो samples लेते हैं, one from transformation zone, one from endocervix. जो transformation zone से sample लेते हैं, it can help you in detecting squamous cell cancer of cervix. Squamous cell carcinoma of cervix. And endocervix से जो sample लेते हैं, it can help you in detecting adenocarcinoma of cervix. Right? So squamous cell को detect करने के लिए sample is taken from transformation zone, and adenocarcinoma of cervix को detect करने के लिए sample is taken from the endocervix. Please remember, you don't have to air dry the slide, and you have to put it in fixative. What is the fixative? 95% ethyl alcohol plus minus 5% ether. ईथर इज हाईली इन्फ्लेमेबल, तो कुछ लैब्स ने अब इसको रखना बंद कर दिया है. देर इज नो एब्सोल्यूट कॉन्ट्रा इंडिकेशन फॉर पैप्समेयर. रिलेटिव कॉन्ट्रा इंडिकेशन इज ब्लीडिंग. Bleeding is relative contraindication, right? Then this over here is a cytobrush. This is a cytobrush. As you can see, इस cytobrush में big bristles हैं and small bristles हैं. Big bristles sample लेते हैं from endocervix. स्मॉल ब्रिसल्स सैंपल लेंगे फ्रॉम ट्रांसफॉर्मेशन जोन. ये जो साइटो ब्रश है, इट इज यूज्ड इन लिक्विड बेस्ड साइटोलॉजी. लिक्विड बेस्ड साइटोलॉजी एंड नॉर्मल पैप्समेयर में डिफरेंस ये होता है. नॉर्मल पैप्समेयर में जब हम स्पेसिमेन लेंगे, आई एम गोइंग टू पुट इट ऑन अ स्लाइड. सो हमने Ayer's spatula से specimen लिया from transformation zone. I am going to spread it on one slide, and on the same slide I am going to take specimen from endocervix with the help of endocervical brush, and I will roll it on the same slide, right? But in case of liquid based cytology, you don't have to prepare a slide. ये यहाँ पे ये जो cyto brush है, ये यहाँ से टूट जाता है, right? It can be broken from here. So the moment you've taken sample, ये जो cyto brush है, it is going to get samples both from transformation zone and from endocervix, right? And इस brush इसको हम अंदर डालेंगे इस fixative के, and we will break it. So directly जो specimen है, it goes into the fixative. Now, what is the fixative which you are using in liquid based cytology? The fixative which you use is methanol. Again, a question. So, liquid based cytology mein, the instrument which you are using is a cyto brush, and the fixative which you are using is methanol. You don't prepare any slide. You don't prepare a slide. Right? अब directly इसमें डाल देते हो. Clear to all of you? Yes? Okay. Now, please remember, pap smear is a screening method. Pap smear is a screening method, right? Based on the report of pap smear, based on report of pap smear, treatment is never planned. Based on report of pap smear, treatment is never planned. You are never going to plan any treatment based on report of pap smear, right? So, अगर pap smear की report abnormal आती है and they ask you what is the next step? Next step is colposcopy and biopsy. या तो ऑप्शंस में पूरा लिखा होगा कॉल्पोस्कोपी एंड बायोप्सी, या सिंपली कॉल्पोस्कोपी लिखा होगा, या लिखा होगा कॉल्पो बायोप्सी. इनमें से जो भी दिया होगा, यू आर गोइंग टू मार्क दैट एज द आंसर. नेवर आर यू गोइंग टू से कि बेस्ड ऑन पैप स्मेयर रिपोर्ट आई एम गोइंग टू डू अ ट्रीटमेंट. प्लीज, यू आर नेवर गोइंग टू डू ट्रीटमेंट बेस्ड ऑन पैप स्मेयर रिपोर्ट, राइट? इफ पैप स्मेयर रिपोर्ट इज abnormal, then if pap smear report is abnormal, then you are going to go for colposcopy and biopsy, except if the report says, number 1, ASCUS. ASCUS का क्या मतलब है? Atypical squamous cells of unknown significance. So, अगर report ये कहती है, the histopathologist saying कि I'm seeing some squamous cells which are very atypical, but I don't know their significance. अगर report ऐसी आई है, then in that case, instead of saying that the next step is colposcopy and biopsy, you are going to see the age of the patient, right? If age of the patient is less than 25 years, you will say my next step is repeat PAPs after 1 year. And if the report age of the patient is more than 25 years, then you will say I will do HPV DNA testing. And just now I told you कि जब भी HPV DNA टेस्टिंग करते हैं आफ्टर एन अब नॉर्मल पैप स्मेयर रिपोर्ट, उसको कहते हैं रिफ्लेक्स टेस्टिंग. So you are going to say I will do reflex testing. Right? Clear to all of you? Yes. Now just before I end this session, just 2 minutes more, I need to explain you one more thing. Now report of pap smear आती कैसे है? Report of pap smear कभी भी CIN नहीं आती. Report of pap smear is never CIN. Report of pap smear कैसी आएगी? LSIL, HSIL, ASCH या ASCUS, ऐसी रिपोर्ट आती है. LSIL का क्या मतलब है? लो स्क्वामस intraepithelial lesion. Right? HSIL means.
Okay, I found this on the web for. Leal का क्या मतलब है? Lower squamous.
Oh my God, what is this? Okay, high squamous intraepithelial lesions. Right? Now, whenever I told you just one simple rule कि अगर रिपोर्ट कुछ भी abnormal रिपोर्ट आ रही है, LSIL, HSIL, ASCH, ASCUS, तो हमें क्या करना है? हमें कहना है that I am going to do the colposcopy and biopsy except अगर रिपोर्ट ASCUS आ रही है. If report is ASCUS, what do you have to say? You have to see the age of the patient. That is one thing which I have told you. Now, another thing which I am telling you is, suppose your report is coming as LSIL and the age of the patient is less than 25 years, then in this case also, your next step is repeat pap smear. These are two exceptions. Right? So the two exceptions are ASCUS. ASCUS में you never do. In ASCUS, you never do colposcopy. And LSIL में, if LSIL happens in less than 25 years, then please don't do colposcopy. In all the other conditions, no matter what the report is coming, you are going to say that I am going to do a colposcopy. Is that clear to all of you? So ASCUS में you never do colposcopy, LSIL में less than 25 years पे you don't do colposcopy. Right? क्या करते हैं? Just now I have told you. But in all the other reports, your next step is going to be colposcopy and biopsy. So either it, in your options या तो colposcopy लिखा होगा या colposcopy and biopsy लिखा होगा या colpo biopsy. It is one and the same thing. Right? So यश देसाई बेटा, colposcopy का क्या मतलब है? Colposcope is an instrument which is a magnifying instrument. जैसे आपका माइक्रोस्कोप होता है ना, इस तरीके का एक बड़ा इंस्ट्रूमेंट होता है जिससे सर्विक्स दिखता है मैग्नीफाई होके. तो हम केवल सर्विक्स को देख के क्या करेंगे? कॉल्पोस्कोपी का मतलब है कि व्हेन आई एम डूइंग कॉल्पोस्कोपी आई एम टेकिंग अ बायोप्सी. So sometimes in your options, rather than writing completely ki colposcopy and biopsy, they will write colposcopy. Is that clear to all of you? Yes? Okay. Now, the last thing which you have to know is that now colposcopy के बारे में. Colposcopy के बारे में few important things which you have to know. Please remember, colposcopy is an OPD procedure. Right? Colposcopy में no anesthesia needed. Right? Colposcope क्या होता है? Colposcope is a magnifying instrument. It is just a magnifying instrument. ये कितने टाइम्स मैग्नीफाई करता है? 30 30 टाइम्स मैग्नीफाई करता है, राइट। कॉल्पोस्कोपी जब हम करते हैं तो इसके स्टेप्स क्या होते हैं? कॉल्पोस्कोपी के स्टेप्स होते हैं, नंबर 1, यू विल अप्लाई 3 to 5% acetic acid on the cervix, right? And you are going to take biopsy. कहाँ से biopsy लोगे? You will take biopsy from aceto-white areas, right? जहाँ जहाँ white दिख रहा है वहाँ से biopsy ले लेंगे. Number 2, there is a button there, right, जो कि green light को on करेगा. So number 2, you will switch on the green filter. Green filter के ऊपर question आता है, right? कौन सी कलर की लाइट ऑन करोगे? ग्रीन कलर की लाइट ऑन करोगे to take biopsy from abnormal blood vessels. तो abnormal blood vessels को देखने के लिए you need green light, and that green light is provided in colposcopy. Please remember, colposcopy से you can visualize the exocervix, you can visualize transformation zone, but not endocervix. Endocervix बहुत ऊपर होता है, so you cannot visualize endocervix with the help of colposcopy, right? Now, last thing, one more. colposcopy की रिपोर्ट कैसी आती है? रिपोर्ट ऑफ colposcopy comes as CIN1, CIN2 and CIN3. Now, अगर रिपोर्ट आई है CIN1, you have to follow up for 2 years. Normally 2 years में CIN1 will automatically regress. Normally CIN1 regresses in 2 years. If it doesn't regress, what are you going to do? In that case, you are going to do cryoablation. No details required, just this much. In this case, you are going to do cryoablation, right? CIN2 and CIN3 का management always is LLETZ. हमेशा, irrespective of age and parity of the patient. तो क्वेश्चन चाहे जितना मर्जी कंफ्यूज करे. So even if your question is saying that patient is 45 years old, she's completed her family, patient is 55 years old, she's completed her family, still you are going to say management of CIN2 or CIN3 is LLETZ. What is LLETZ? Large loop excision of transformation zone. Clear to all of you? Hysterectomy is never done for managing CIN. Hysterectomy is never done for management of CIN. So that completes your CIN along with screening methods. Now, any queries do you have? Any queries? Any queries? Anything which you need to know? Anything which is not clear? Please remember that CIN2 and CIN3 के लिए always LLETZ. या तो ऑप्शंस में LLETZ लिखा होगा या लीप लिखा होगा. दोनों एक ही नाम है. Both are the names of the same procedure. LLETZ or leap. Genital warts, Akhil Desai, genital warts never leads to cancer cervix, and I will be telling you more about genital warts in my session tomorrow. So cancer cervix I will be taking up tomorrow, right? Okay, so please revise this. This is very, very important, extremely important. So I'll be taking up HPV vaccines and some part of cancer cervix tomorrow, and then day after tomorrow the complete management of cancer cervix, right? Okay, so take care all of you, all the best. A list of all the important topics which you need to know on FMG, just go and check out my Instagram handle. I have posted it there. So if you don't find it there, then let me know. I will again repost it. Right? Take care. Bye bye. All the best, bacho.